Hello all. My presentation looks at the causes of antimicrobial resistance and hopes to inspire you to prevent the growth of this issue. I'm a nanoengineering major who works in a nanomedicine lab, is starting a club about this issue, and wants to solve drug resistance for a career. Here is the basic definition as used by the World Health Organization. Essentially, it is a phenomenon of microbes evolving so our treatments no longer work. Building onto that definition, we see that antimicrobials are split into many categories. For the purposes of this presentation, we will be focusing on antibiotics. You may be wondering why I care so much about this issue. I was a pretty sickly child, so I was always given antibiotics, but I later learned that this treatment was inappropriate because antibiotics are often unnecessary. To help you understand the dependence on antibiotics, here is a graph from a study conducted by a consortium of global researchers in 2015. A daily dose is the number of doses a patient needs in a day. Over 50 billion daily doses a year are consumed. Now, that is a lot of antibiotics. So to help you grasp the brutality of a case where antibiotics don't work, I'm going to tell you a story based on my reading of Mayo Clinic's article about this type of infection. The story repeats itself thousands of times annually. Let's start. You wake up one morning and you notice a pimple. You feel sick and you find you have a fever. No big deal, you think. You've been sick before, so you decide to take Tylenol and take the day off. You've probably already forgotten about the pimple. But as the next few days go on, you don't feel any better. A week goes by and you thought you could tough this out, but you can't. The pimple looks like a blister and is incredibly painful. You decide to go to the doctor because the pain really is horrendous. You go to the doctor and they swab your blister for tests. The results are obtained in a few hours and the doctor is disheartened. He orders you admitted to the hospital and you come to learn that you have been infected by MRSA, methicillin-resistant Staphylococcus aureus. The methicillin-resistant part of its name means that this bacteria is resistant to a former drug of last resort, methicillin. From the pimple, the bacteria infiltrated your muscle and bloodstream until it's serious. Your treatment success is down to luck and it will involve a cocktail of drugs. This is the human cost of drug resistance. Over 700,000 people are expected to die of drug resistance annually. When our only defenses against bacteria fail, we're back to the 1800s. As this graph from the Antimicrobial Resistance Review shows, the scenario I presented will be repeated millions of times by 2050. Antibiotics have made us forget the dangers of disease. Now, back in the 1800s, millions used to die of disease, but antibiotics let us treat that, and now we've forgotten it. The primary mechanism for drug resistance is natural selection. When you take antibiotics, a couple of bacteria may be resistant. If these survive, they can lead to a more drug-resistant generation. Over many years in patients, an entirely resistant strain is born. Agriculture is a major contributor. The crowding of animals in industrial agriculture means that disease is rampant. So antimicrobials are continuously provided to maintain profitability. The bacteria become resistant and they end up in people through food. But the primary cause of drug resistance is overprescription of medication by doctors. As the Pew article says, 30% of antibiotics are prescribed unnecessarily, meaning bacteria have a 30% more chance to develop resistance. So why are we so tolerant of being drugs we don't need? Rachel Cohen of NPR found that we actively want our doctors to give us these medicines. The study also found that there was a 66% increase in patient satisfaction if the appointment ended with prescription for antibiotics. Doctors now fear that not prescribing antibiotics will lower their ratings, which is unnecessary social pressure. So, why is it impossible for antibiotics to always help us as people think they will? Antibiotics will only help us if we have a bacterial infection, but many common illnesses are from viruses. The more we use antibiotics, the quicker they will lose their effectiveness for the intended target. Let's try to extrapolate the future from the past. Now, you can see from this graph that a new drug will have its bacteria be invincible within a decade. The picture is nearly a decade old, which means that the drugs at the end of this timeline are no longer effective. We were also having trouble inventing new drugs. In other words, the future does not look good. Now, finally, what can you do to stop this? Well, you wash your hands, but avoid using antimicrobial soap. And please don't force yourself on your doctor and vote with your dollars and buy things which don't have antibiotics used.